Well, thanks for that question on hospitalizations. And when I look at our overall statewide capacity, we have hospital capacity. But I think we need to also look at that regionally because we know folks get hospital care near where they live. So one of the places we're watching very closely is the Charlotte area in terms of hospital capacity. That is a place where we've seen higher rates of hospitalizations in that area. Again, I'm not needing to do anything different right now, but we are having conversations with them every single day, as we always do, to make sure we know how they are managing their patient loads and what is going on within their hospital. So we're in close coordination. Right now, I know we have capacity, and that is good. The other positive news that I would say, while we're seeing hospitalizations go up, we're actually seeing ICU, or the intensive care unit, utilization stay the same. So that is a good sign. So we're seeing more patients in the hospital, but less of them needing that highest level of severe kind of care that we would see in hospitals. That's a good thing. I think that's a combination of both the great work of our scientific and doctor community, both getting better at treating COVID-19, having new techniques like proning people, using dexamethasone, a new medication that improves mortality or makes sure that more people are living with after getting severe COVID illness, using remdesivir. So I think there are a number of things that we have learned about this virus, and it's keeping people out of the intensive care unit, and I think that's a good thing. But we're going to still watch it closely because the intensive care unit is the resource that is the most limited here in the state, as in every state. But that is a good news that we've been relatively stable for intensive care unit usage. Our hospitalizations overall going up. Again, statewide capacity feel very good about. There are certain regions that we're looking at more intensely, the Charlotte area, the Mecklenburg area being one of those places where we're seeing the hospitalizations tick up a little bit faster than the rest of the state. And so we're going to work closely with them as we go. But no, as of right now, don't need to take any other additional actions. But I'd just go back and remind folks that it is the actions and the simple things we do every day, the wear, wait, wash, that is going to prevent us from overwhelming our hospital systems, because we don't want to go to a field hospital situation. That is unideal in every way for us to be able to have to do care outside of the hospital walls. I'll say as a physician, that is not how we want to be caring for folks, whether they have COVID or not. And so we all need to do the hard work to make sure we don't get to that place. Thanks.